With this being Breast Cancer Awareness Month, our focus for today is the importance of getting mammograms. Also, there are new guidelines from the federal government that could mean you're due for one sooner. Talking about the importance of mammograms, talking about the new guidelines, Dr. Joanna Sadowska Sadowska. You know what? Seriously, I swear I told myself I wouldn't butcher her name, and I did. But Dr. Joanna Sadowska with North Mississippi Medical Center Cancer Center is joining us now to talk about this. I kind of take for granted that, everybody knows about when to get a mammogram, why you should get a mammogram, but just set us at the table for us. Tell us why and when.
So thank you for having me, first of all. And we follow all the guidelines of major breast cancer societies. So American Cancer Society, Breast Imaging Society. We also follow American College of Radiology, which say start mammography at age 40 and perform annually, so every single year. And that's in addition to self-breast exam and clinical breast exam by practitioners as well every year. So we follow those guidelines. And that is for average risk women, which essentially means women that do not qualify for high-risk screening, and that would be women that are more than 20% of high risk of breast cancer in their lifetime. And there's ways to determine that number, and we do that at the Breast Care Center here at the North Mississippi Medical Center on every single patient. So every patient gets their number before they leave.
Share with us something, or maybe a couple of things that people maybe don't think about or don't know about mammograms that they need to know or should know.
So mammograms are usually painless. There's maybe a little bit of discomfort. They're very reliable. They are a little bit less accurate or sensitive in dense breast tissue, which we can talk about. But overall, they're very sensitive, and they are sort of gold standard for breast cancer detection. So we always recommend start with breast mammogram, and then depending on your risk factor stratification, you can get other modalities such as breast ultrasound, ABUS, which we can talk about as well, and breast MRI, which is actually the best study that we have for detection.
Quickly, before we run out of time, we had mentioned the government's come out with some new guidelines. Can you briefly touch on that for us?
So just real quick, so actually just last month, there's been a new guidelines called the National Breast Density Detection Guidelines, and that means that every single patient is supposed to be notified of how dense they are, and also told, are you dense versus are you not dense? And that is very crucial, because the denser the patient is, the more likely they are to actually get breast cancer. That is independent risk factor. And also, it's more difficult to detect breast cancer in those patients, so they need additional studies, such as the ones I mentioned. Ultrasound, automated breast ultrasound, acronym for that is ABUS, which we offer. We're the only institution that offers that in our area in North Mississippi, and breast MRI. So if you are dense according to your mammogram, and you can know that by your breast report, by your breast imaging report, then you need more than just mammogram.
Dr. Joanna Sadowska with North Mississippi Medical Center, thank you so much for joining us live on Studio 9.